Hello. Welcome to Question Strategies for taking the CPC. That's the Certified Professional Coder exam from AAPC. This is part 4, so let's get going with our questions. A patient has come to see his physician. He fractured his right humerus 6 months ago and it was healed well. However, every time the patient raises his right arm, he experiences pain. Which is or are the appropriate ICD-10 codes for this question? And as you look, you can see we have S codes and we have an M code. Now, the S codes do relate to broken bones and such, and the M codes in this case are relating to pain. So let's begin by picking out our keywords. So he fractured his right humerus 6 months ago and he experiences pain. So he's here for pain. Now, yes, it's due to the fracture, but the fracture is old. The first thing I would do is look at these codes. I'd go into the S codes and look to see what that seventh character means. There's an A and there's an S. Well, the A is normally the first encounter of something or as far as the broken bone, and the S is a sequela. What that means, it's old, and that's what we need. We need to reflect the fact that this fracture is an old fracture, not a new one. So we have B that has the S code with an S for the seventh character, and D, which has an S code with the S as a second character. So we would not need A or C. We know that because we know the S is sequela and the S is for a late effect or an old injury. Now, he's here for pain. The answer is he's here for pain. You would not put the S code first. The S code is an old fracture injury. That comes second. The answer for this case is B. Unspecified fracture of the upper end of the right humerus, and he has pain in his upper right arm. So I hope you see how we did that. We looked at the seventh character because there were only two characters. So if we could distinguish which one we needed, that cuts down on different answers we have to look at. And since he's here because of the pain and not because of the old fracture that didn't break again, the M code comes first. So let's continue on. Whoops, I jumped ahead, but that's okay. A patient was brought into the hospital ASC, ambulatory surgery, to have a 2 centimeter malignant lesion excised from their right arm. The defect was closed with a simple repair. What are the CPT codes for this procedure? Okay, you have a couple of different scenarios. We have 11602 and 11622. I do know that that is the malignant area. As you go through and as you continually look up things, you start recognizing codes. But if I didn't know, I would be curious to know what the 12,001 represents. Well, that is a simple repair. Is that what you need? No. When you have a simple repair, and you can find this out by looking at the beginning of the malignant lesion as far as being excised. When you look at the beginning, you'll find out that if it's a simple repair, the actual repair is included within the code. If it's not a simple repair, if it's intermediate or maybe it's very complex, then you can add the 12,000 code. So up above the 11602 and that 12,001 is a simple repair. But as I was mentioning, since the guidelines tell us that a simple repair has to be included within the code, you don't code additionally. All right, let's look at the next one. What is meconium? Now, there's not much on keywords. I mean, we have to look up meconium. You are going to have questions on this tests that are, you know, medical terms, anatomy, physiology, and you may not remember. So what do I do when I look at a something and I can't remember what it is? I go to the index. Sometimes you'd be surprised. You can find out a lot of information in the index. So they are saying, what is meconium? It is a drainage that occurs with severe burn. It's someone who has webbed toes. It's the first bowel movement an infant would have, or it's none of the above. And of course, meconium would be the word. Now, I would start with the ICD-10-CM book just to look because a lot of times diagnoses are a little more detailed. But if you couldn't find the answer there, you can always look into the CPT index and see if you can find something there. So when I go into the index for the ICD-10 book, this is what I find. I have meconium. It's showing newborn, newborn, newborn. Guess what? Meconium deals with newborns. Now, do I necessarily still understand what meconium is? Well, here in the case, I could tell it's the first bowel movement an infant would have. But if I didn't, I could see the referencing all newborn. And if this is the only infant answer, that would be the answer. I hope you understand what I'm trying to say. If you come across a term or A&P that you're having trouble understanding or recognizing, go into the index, see if it can give you hints. Sometimes you'd have to go into the tabular index just to take a peek. I've found a few answers there too. Okay, so Dr. Smith saw John for his maintenance of his diabetes. The doctor confirmed that John is taking insulin and has stable blood sugars. What would you code? Uh-oh. The doctor didn't tell us what type of diabetes that John has. Is it type 1? Is it type 2? If you go into your guidelines for the diabetes chapter, you're going to find that whenever diabetes isn't mentioned, you default to type 2. Type 2, when you get right down to it, is the more prevalent form. Type 1, if you remember, it's a total absence of insulin from the pancreas, and it normally affects children or young adults. So it's type 2. And if you go into the book, I can tell you that E10 is type 1 and E11 is type 2. So we have maintenance of diabetes, he's taking insulin, and he has stable blood sugars. Okay, if it's stable, we only have two choices. We have E11-9 and E11. That's diabetes 2 with no complications. In this case, we're saying they're stable. So the Z79 is actually the long-term use of taking insulin. When somebody is diabetic, yes, you have to reference the diabetes codes. But if they're taking a hypoglycemic drug or if they're insulin for a long period of time, you would still have to reference that too. The only difference is, let's say somebody came in, they normally take hypoglycemic drugs, but their blood sugars are way out of whack. So they bring him to the hospital, they leave him on insulin for a few days, and then he goes home. That insulin wouldn't necessarily be part of it because it was just used in the treatment. It wasn't a long-term use of the insulin. So in this case, we have E11.9 and Z79.4. Now, there is one for hypoglycemic drugs too, so don't forget that one either. So what is not part of the global surgery package? During the post-op visit, the doctor treated the patient for an unrelated condition, for writing orders, an EM visit by the doctor on the day of surgery, or evaluating the patient in the recovery room. Now, in the beginning of your evaluation and management chapter, you have your guidelines, and within those guidelines, it's not the EM chapter, I apologize, it's the surgery chapter, shows you this particular question as far as global surgery package. Now, this is what is not part of the global surgery package. Be careful of those little words that pop up. Now, I've taken this straight out of the CPT guidelines for the surgery chapter. Now, it's saying that E&M service subsequent to the decision for surgery. So, in that case, that would be C, an E&M visit by the doctor on the day of the surgery. So, that one's okay. Now, second one, local infiltrates, when they have to actually do anesthesia. That's not one of the answers, so I'm not going to worry about it. Immediate post-op care, including talking to the family or doing other things, writing orders is there, and evaluating the patient in the post-anesthesia recovery room. So that's part of it too. So the only one that's not part of the global surgery package has to do with during the postoperative visit, the doctor treated a patient for an unrelated condition. So if you see this type of question, you're probably going to see it as a choice. So that does conclude this one, and I want to thank you for participating.